You know what? We have always noticed that you have always given up the information more than required.
Exactly.
And that is very cool from your end.
Yeah, I think so, because there should not be any conjugacy in giving information.
Absolutely,
You
absolutely,
know,
absolutely.
some people feel, that giving information means you're creating competition. It's not true.
Absolutely.
I don't think so.
Absolutely.
Because it is one thing having the information, and second is execution based on that information, which is what matters most.
You are watching Surgery Simplified. शस्त्रकला सरल शब्दों में.
Okay, so this is behind the scenes. So doctor, how are you feeling about Surgery Simplified?
I'm feeling very nice, and I think the team is doing a great job. And for the audience this is Shirish. He's the
Hi.
director and the producer and karta dharta of this event. And it is his idea that we should have a conversation rather than a monologue. But I think most of the time it turns out to be it ends up being a monologue, because Aishwarya doesn't have much to say. Since it's a little technical. But I think we are getting a very good feedback from whoever I meet, and if they've seen our videos, they always comment that the presentation is good. And I believe that it is one of the best produced videos on YouTube at the moment, because I do see a lot of YouTube just to see what others are doing. But most of the times they have one camera and one person speaking with one background and nothing more, and not much to say about the content either. Because we do a lot of research, and we do work after the video is shot also. A lot of work is done to produce the graphics and the thing. The whole endeavor is, of course, to make lay people understand complex surgical concepts, which is
Absolutely.
difficult to begin with, because weight loss, diabetes, vitamin deficiency, these kind of things are easy to talk, because they are generally people know about it, they are aware to some extent.
Sure.
But when you talk about, for example, today we did erectile dysfunction, many people don't know what is at work, what is happening at what level, so we try to, so it has to be a balance between giving information, but at the same time not making it too boring.
Right.
So it should hold the attention of the viewer. I think we are succeeded to a far extent in that, because we try to keep it below 20 minutes as far as possible. Of course, some episodes do go 2-3 minutes above, but the majority of them are between 15 and 20 minutes. I think that is, quite an achievement, because the topics are so huge that if I were to talk on a single topic, I can talk for 1 hour.
Right.
For example, today we did bleeding in the urine. Now, blood in the urine, bladder cancer alone, I can talk for 1 hour.
Right.
Or renal cancer alone, I can talk for 1 hour. But it is not a surgical conference.
Right.
We are talking to lay people. Basically, we want to tell them that if you have blood in the urine, go to the doctor. Don't neglect it, because it could be the sign of cancer.
Absolutely. Absolutely.
That is the take-home message. Even if that happens, and even if 2 people out of many people do go to the doctor and they get treated in time, our purpose is served.
Absolutely.
Because here it is not only knowledge, it is also knowledge with the intention that there should be action followed by the client, the viewer, whenever he encounters such a surgical problem. Or they can go back to our library of videos and check back as to what is required to be done.
Absolutely.
So I am all the time thinking from the angle, because being 40 years in surgical practice, I know what the problems of patients are, why they come late, why they don't want to get operated in certain conditions, what are they scared of, So I know that. That is why I'm emphasizing every time, as far as possible in most episodes, I try to give a take-home message, which is that you need to go at certain point in any illness, you need help from the professional. Absolutely. You can't just, put your head down and say, okay, it will go away. Cancer, it will go away. It will not go away. It will grow.
Right.
Your chance of survival is best if it is in stage 1 or 2, any cancer.
100%.
But if it goes into 3 and 4, even a treatable cancer then becomes untreatable.
Right.
But people don't understand. Like I told you, so many times, piles is a simple 15-minute operation. And the hemoglobin goes down to 2 grams. I have seen 2 grams. They can hardly walk, so weak they are. You have to give them 5 bottles of blood before we operate them. Why? Because they have some misconception that removal of piles causes impotence. How can it cause impotence?
Right.
If you don't know, ask. So that I've mentioned specifically in that episode on piles. That
I
has
think-
nothing to do with impotence.
I think this information has definitely helped everyone.
Yes.
And I have one very good question for you. We have been seeing you speaking continuously for such a long time. How do you do that? How do you have so much of memory? Where do you store? Do you have an external hard drive? I always have this thought. I mean, how can you
I
speak
think
so?
most of our episodes are one take and one shot we do.
I keep on wondering how do you do that? Because we don't have any reader, we don't have any other device to support.
Yes.
Whenever we bring in a topic, you are like, start.
Yeah, because
You're on.
most of the things I do, in my consultations also, I try to give as much information to the patient, so that they can take an informed decision. This has
Right.
been my habit since I was doing surgery. I mean, learning surgery. It's not that it is developed afterwards.
Right.
So I tend to draw diagrams and explain. And the most common feedback that I get, असं आम्हाला दुसरं कोणी सांगितलं नाही. Nobody else has told us like this.
Absolutely.
That actually prompted me to make this series.
Right.
Because I find that a lot of doctors, for whatever reasons, maybe because of brevity of time, maybe they don't want to do, don't want to give, they feel it is too much to do it. They don't tend to give a lot of information to the patient. And when it comes to giving consent for surgery, it is a big deal for the patient. It's a once in a lifetime event, basically.
Absolutely.
How many people have surgeries repeatedly? So it's a once in a lifetime event. So you have to understand the gravity of the situation. For us, doing an appendicectomy is 15-20 minutes. We say, okay, okay. But for that person, he's all this. He's unfamiliar atmosphere. कपड़ा चेंज किया है, ऊपर टोपी डाला है, मास्क डाला है, टेबल पे लिटाया है, बड़ा लाइट ऊपर से एक दाढ़ी वाला आदमी खड़ा है, वो उसको मालूम नहीं कि ये दाढ़ी वाला आदमी ऑपरेशन कर सकता है कि नहीं कर सकता है. I always say it's like when I sit on plane,
Right.
I say my life is in the hand of the pilot. I don't know how good he is. It's the same
Absolutely,
effect.
absolutely,
This
absolutely.
fellow, he doesn't know. He has full faith in me that that all that psychological baggage that comes with the surgery, many times we tend to take it for granted, because for us
Right.
it is just another appendicectomy, but it
Right.
is not.
Right.
It is not for the patient.
100%.
That is very important. In fact, I am also trying simultaneously to sensitize my colleagues, whoever are watching the episodes. So I do spread them to them. I don't know whether they watch or not, but the one take-home message for them is to sensitize them that it is not a big deal for you. For example, a cardiac surgeon doing bypass surgery every day, holding other people's hand, beating heart in his hand and suturing and cutting and doing, is not a big deal for the cardiac surgeon, but it's a big deal for him, his family, his extended family and friends.
Absolutely.
They don't know whether the guy is going to be alive or not at the end of the surgery.
True.
True. So you have to be sensitized to that part. That's all.
Right.
And I found that, even and in my career, I have never refused surgery to anybody, even if I know that the patient may die. Even if I know that there's only 1% chance that he'll live, I'm willing to take that. And I've been doing that right from the beginning, not now.
Nice.
Now that I'm a senior surgeon, I can get by many things because of white hair. But even when my hair was black and I was not wearing these thick spectacles, I've been doing this.
I understand.
So the thing is that, if you talk to the patient and the relative and explain to them the logic,
Right.
and do not take the patient for granted that he is a villager or he is that. No. They all understand everything. If they can vote properly in this country and they show this voting pattern that they vote differently for state elections and differently for national elections, it's happened repeatedly.
Right.
It means they're very aware about politics, and politics is far more difficult than talking about surgery to them.
Absolutely, I understand.
Isn't it?
Absolutely.
So don't take anybody for granted. I feel that you should talk to patients, whatever information you want to give it to them. The chances are that you will actually end up with, even if there's a problem, if you have already told them that problem can occur, they will take it in their stride. But if you don't tell anything and then problem happens, then it starts, medical litigation starts from there because of lack of communication.
Absolutely. You know what, we have always noticed that you have always given up the information more than required.
Exactly.
And that is very cool from your end.
Yeah, I think so, because there should not be any conjugacy in giving information.
Absolutely.
Some people feel, that giving information means you're creating competition. It's not true.
Absolutely.
I don't think so.
Absolutely.
Because it is one thing having the information, and second is execution based on that information, which is what matters most.
Absolutely.
You may know the steps of operation, but you may be a bad surgeon.
100%. 100%.
So execution is very important. You must have the information, you must know what to do and do it also.
Yeah, well said, doctor. So now today, I think we finished 40 episodes.
Yes.
And there are so many other episodes to
Yes,
come in.
but then now they are all outside the purview of what I do in my practice. So we probably will have a different,
Experts
way of
coming
doing,
in.
Yeah, we'll get the domain experts, and I will probably work what Aishwarya is doing, interviewing them and getting the information out for the viewers.
Sure.
Because we next want to do gynec and obstetrics, then we want to do orthopedics.
Right.
And then we'll see as we go along other things like surgical oncology and things. That's why I'm not given in detail about, today I said blood in the urine, renal cancer. There's no point in giving details. When we talk about renal cancer alone, as I told you, each cancer can be a episode itself.
Right. Understood.
So then at that time we will get a surgical oncologist or a urologist or a uro-oncologist. Nowadays there is a subspecialty of uro-oncology, only treating oncology within urology also. So we can get the absolute domain expert to talk on that. And that would be better because they are the ones who are day to day doing that. I occasionally may do a cancer or work with a cancer surgeon and do occasionally 1 or 2 cases. In maybe a year, 2 years, I may do 1 or 2 cases. That's not domain knowledge. I mean, these guys are doing day in, day out.
Absolutely.
So they will be able to enlighten the viewer as to, whatever relevant information is necessary for them to take informed decision as to what to do, even where to go.
Right.
Where to go for treatment, because when it comes to cancer, when there are multi-modality treatments, surgery is not the only thing. There are many other things which are
happening around it.
Yeah, it's related. One step. Surgery is only one modality. Then there's radiation. Then nowadays there is immunotherapy and so on. So many things are there. So you need to be aware as to what is the cost. Where will you get all under one roof? Like Tata is one place where everything is under one roof. Simple example I'll tell you. For the head face neck cancers which we discussed today, one of the very important things is that after the surgery is done, there are people who will, because your speech is affected, there is a speech therapist there itself.
Oh, okay.
Then before you undergo radiation, there is a dentist who will do the scaling and cleaning of all your teeth, which is necessary, because if you do radiation with any kind of cavity, it will
affect.
Yeah, it will flare up.
All right.
Now all these things, otherwise what happens, if you go get your surgery one place, then you are getting radiotherapy somewhere else, you go to a third dentist to get your scaling done, and to a speech therapist to improve your speech, all that at different places. Here everything is under one roof, because these things are equally important in the recovery phase or in the radiation phase. And post radiation, there are a lot of burning of the skin, and you need a dermatologist, you need certain creams which are specifically meant for that. The pharmacy has that. You'll have to go searching if you go somewhere else.
Right.
What I'm trying to say is that it's a complete package.
100% right.
Oncology especially has now become like that. It's a complete package. So people should know which is the nearest such center where they are living.
Right.
For example, we are in Karnataka, whether somewhere in Bangalore, somewhere in Hubli, somewhere in between, there would be a place where all this would be under one roof. So even for the doctors like us, even if we do the surgery, we should then refer them to
a place
that
like
place
that,
where everything else is done under one roof.
100%.
So that kind of thing is what I'm planning to do. So that ultimately what we want is the patient should go to the correct person, to the correct institution, both from the point of view of facility as well as from the point of view of his pocket.
Right.
And then get the treatment done.
Right.
And basically nobody should be denied medical treatment of the best quality, whatever their financial status.
Sure.
This is what I maintained always.
Sure.
That irrespective of their financial status, the quality of treatment given should be the same.
At par.
Whether it is a rich man or a poor man, you can charge differently, but what material you use, what equipment you use, what infrastructure you use is in your hands.
Right.
That can always be brought up to a certain level, because that is the best way to get least complications and early recovery. Because a lot of modern surgery is now dependent a lot on the quality of the equipment that you are utilizing.
Excellent.
For example, if you are using laparoscopy or keyhole surgery, the camera and the other equipments are very important. They should be very good quality. If they are not good quality, it will affect your outcome, surgical outcome,
Sure.
directly. If you are not able to see the on the screen the operation steps properly, how are you going to do it?
I can relate it.
Isn't it?
Yeah, absolutely, absolutely.
Then, for example, the cautery. Now, what happens is when you're using a cautery, there is a little bit of spreading of the current. Now, good cautery, the current doesn't spread. And we have seen regularly that, hysterectomy, when I'm removing the uterus, some spread of the current has hit the bowel without the knowledge of the surgeon. It's not his fault, equipment fault. He is far away from the bowel, but the spread of the current has hit. And after 8-10 days, that burn has gone into perforation. Patient has got life-threatening peritonitis, what we discussed. They developed a perforation in the bowel. Now, why did that happen? Not because the surgeon was bad in doing his surgery. It was bad equipment, which caused the current to spread.
Right.
Now, if you had used a good cautery and a good instrument, the current won't spread. This may cost 10 times more, but isn't it worth it that if you can avoid a complication which is potentially life-threatening?
Sure. Yes.
So that's what I meant, that when it comes to modern surgery with modern equipment, it is very important, the selection of the equipment is as important as or become more important than earlier. When we started surgery, we wanted a light, one table, one suction, cautery and instruments, and rest is done with our hands. Right. Anything happens, our hands are there to take care.
Right.
But now that is not the case.
100%.
And what happens, these things are not even detected at the time of the surgery. They come up after 10 days after the patient has gone home.
Right.
So that's what I'm trying to say.
That's great. That's great. In fact, so I wish that we do 1,000 episodes.
Oh yeah, of course.
and
well, I don't know about 1,000, but I've got 150 topics when I first thought of Surgery Simplified, out of which 40 are done. So we are just 1/4 the way.
No, but I really wish that we continue the same way and maybe have a celebration for 1,000th episode.
Yeah, sure. And that again depends on you, the viewer. Please, like, subscribe, and tell your people to all your friends and contacts that they should, subscribe and encourage us by just watching our episode. We take a lot of effort to make them.
Absolutely, Doctor. Thanks a lot.
Thank you.
We will catch up again then.
Yes.
All right. So, Vinay, how are you feeling about Surgery Simplified?
It's feeling very nice. Actually, I'm getting to know what all doctor is saying. It's all very new thing for me. But it's really interesting, looking forward to it.
Okay, and are you bored of shooting such episodes?
Some episodes are very good, I don't understand anything. But yeah, but many, a lot of things are there, which a common man also should know about.
Right.
Because before going to a doctor,
Right.
they have this information, they're already ready.
Right.
What they want to do, how they can go ahead with it. So it's a good thing, I can say.
Absolutely. So, I have seen you always shooting movies and serials or dance or any of those are of more, action kind of thing. This is like an interview format, and you're doing quite well. Thanks a lot, Vinay. I would like to tell you that your cooperation and your help has actually refined the way how Surgery Simplified has come.
Thank you so much. Actually, I appreciate that I have been part of this journey, and we'll go along.
Absolutely.
There's a lot of things to do.
Absolutely.
So
Thank
there's
you.
no problem at all, yeah.
Thank you. Thanks a lot for being a part.
Thank you so much.
All right.